Hey everyone, thanks so much for joining me on the BioBreakthroughs podcast. I'm your host, Jared Taylor. Really excited for this conversation today. We're going to talk about Rice Biotech Launchpad's just all things, your recent announcement, and I'm going to kick it over to our guests today, and they're going to give quick intros, and then we'll dig deeper.
My name is Omid Veiseh. I'm a professor in the Department of Bioengineering here at Rice University. I'm also the director of the Rice Biotechnology Launchpad. Yeah.
I'm Paul Cherukuri. I'm the Chief Innovation Officer for Rice University and Vice President for Innovation for the university. Lead a lot of our efforts to create speed and scale from the research that we do inside of Rice to get out into high impact, high quality technology out for the real world. And then the Launchpad was one of those such entities that we recently started. Happy to be here.
Well, excited to chat with both of you. And congrats on all the success thus far. This Launchpad is really interesting. Rice is always. It seems like you're always in the news for doing something innovative, and this just continues that pathway. Talk and feel free, whoever wants to take the questions first. I'll leave that up to you. But given the Rice Biotech Launchpad's like emphasis on bridging the gap from laboratory discoveries to commercialization, can you both talk me through the strategies in place to basically facilitate a more seamless transition? And then I guess part two to that, sorry, that's a huge question, but how does this approach distinguish the Launchpad from these other biotech accelerators that exist on the market?
Yeah, so great questions. Maybe I'll just go ahead and get started to tell you what our vision for the Biotech Launchpad is. Of course, there's a lot of efforts around the country to accelerate innovation towards commercialization, product development, impact. We're focused in the biotech space, largely therapeutics. Our vision is to bring Rice technologies to the clinic as fast as possible. And the model by which we work, we're actually more of a venture creation firm rather than perhaps an accelerator. And I'll kind of talk to you a little bit about the distinction between our view of how to do this versus others. We really start with the clinical unmet need. Again, we're fortunate to be right across the street from the largest medical center in the world, and we can source problems quite easily. We go across the street, meet with different clinicians, and really try to understand in a much more sophisticated way where the gaps are in terms of how patient care is managed today, and really focus on developing disruptive technologies that fit really nicely towards that problem. And then once we have that identified, and not superficially, but like the details, the questions that we ask are our innovation process starts with thinking about these big what if questions. And of course, it's not like what if we could cure cancer. Obviously, that's exciting, but we want to try to really refine that and understand what is the gap. And thinking about it from multiple approaches, multiple modalities. And once we have that kind of really identified, we call that the target product profile, which is like, what does the technology have to achieve for it to be impactful in this setting? We'll come back to Rice, tap into the engineers, the talent that we have at the engineering school and the natural sciences, really kind of challenge our community to work together to build that killer solution. And at the same time, partner with the business folks that can kind of help build a venture around this concept and think about things like regulatory, manufacturing, all of these critical gaps early on in the process. And then, that's when a project enters into the launch pad. And we'll spend, 2 to 3 years to build the minimum viable product, build the management team, help the company secure capital and the right talent in terms of critical employees to spin out as an independent company.
Yeah, I think he just gave you the tightest thesis of all this that I think heard to date. It's an interesting model because a lot of like you mentioned, Jared, there's a lot of folks who have accelerator models, right? And the distinguishing feature here is that it's really a venture creator. It's this venture engine, and that's what Omid came to me with and others to see if we can push this forward. And it was a real no-brainer on our part because Omi knows how to start these companies. He's well equipped and experienced at this. From his background, he's had several, and we wanted to have high impact from the university, so we made the investment to help him go forward, and then he just drives it and creates a number of these product kind of fit venture entities that we know we're targeting so that we can get it out the door and get into the market as fast as possible. Omid said this famously to me anyway, uh, many years ago. He was saying the fastest way to really translate your technology is to get to humans. How do you get to humans as quickly as possible? Jump, as quickly as you can from the animal models because the animal models won't get you there, which is absolutely spot on, right? So that's something that he also has folded into this. How do you get to human clinical trials? How do you get to testing patients as quickly as possible? And then you speed it up. The other side of it is to add the capital piece to it, the regulatory piece, like he was saying. You have all that baked in, you're going to have acceleration of the venture so that it gets into people's lives quicker. That's the real magic of this Launchpad. And I think it's just a fascinating model that we're proving and instituting into the university because it's been tried and true by him primarily as an individual entrepreneur. Now he's really folding it in and then training up other faculty and students to really do that. That's what's really cool.
What I found really interesting, it almost seems like you're in between a venture studio and an accelerator. Like you're providing kind of the best of both, or more of combining the two, right? The best of both worlds to help drive innovation and build out these companies. And you're doing it in the Houston area. So one of the cool things I think that you're doing and aiming to bring is that Houston to the forefront of medical innovation ecosystems, which I mean, Houston does have that recognition already. So the fact that you're building this here makes a ton of sense. But I guess the question I'm trying to get to is how do you envision your initiative impacting not only the local community but also on a larger scale, contributing to the advancements in biotech on that national scale?
Yeah, I mean, I think ever since the announcement, we've had a really a tremendous amount of interest from venture capitalists, but also people who are leaders in the biotech business community, including pharma, that have really reached out and they're excited about what we're doing. Largely because I think for years there's been recognition that in Houston there is quite a lot of innovative technology, and of course, we are a unique city because we do have the largest medical center in the world. And a lot of the clinical trials take place down here. In fact, in oncology, about 70% of the clinical trials take place at MD Anderson. And so the biotech companies, the investors, they're familiar with Houston from that perspective. But there really has not been, until now, um, I would say, a coordinated effort across all the institutions in Houston, within the Texas Medical Center, Rice, and other entities to really kind of drive building the ecosystem. I think a lot of the catalysts, the reason why we thought, why now, is largely because the Helix Park campus is a significant investment to really build the the ecosystem that exists in other cities. When we think about San Francisco, Boston, San Diego, Houston can do it in its own unique way, where it would be competitive in certain spaces with those ecosystems. One of the unique things that we offer is having it all in one campus, the Helix Park, 37 acres, $5.4 billion investment over the next 5 years to really build the place where the innovation can happen, when the company creations can take place, to really attract the top talent, there's certain modalities where it's become clear that in order to increase the likelihood of success, you really need to have the inventors working more closely on it. I'm thinking about cell and gene therapies. These are or complicated devices that have a lot of innovative parts. These types of modalities, which are poised to have a big impact in medicine, really need the close interaction of the inventors working with the business people, working with the clinicians, longer into the tech transfer phase than, let's say, a typical like small molecule drug. And I think that is going to, the ecosystem in Houston is really going to try to help facilitate that. And that's where I think we have a unique, unfair advantage um, compared to other cities, just because it is all going to be together. You walk in the Helix Park campus, there's all these buildings. It doesn't really matter. You won't immediately be able to tell who's from MD Anderson, who's from Rice, who's from pharma company X, who's from biotech startup. It's all mixed together in this innovative space, which has been designed to optimize interactions, designed to optimize um, collaboration and acceleration of ideas to clinical practice. So I think that type of ecosystem doesn't currently exist, maybe outside of Boston, but there's certainly ways where I think, in Houston you can be differentiated. And of course, San Francisco, they've done great, but if you look at that ecosystem, it's quite fragmented and spread across. So if you're, meeting with people at Stanford, Berkeley, UCSF, that's a large distance you got to travel. I mean, you might as well be in different cities because you're going to be talking on Zoom. You're not going to be going back and forth. It's not going to be as tight knit of a culture as what we're creating down here.
Yeah. Uh, just to add to that, I think it's absolutely accurate. One of the interesting things about Houston is we're spread out quite a bit, right? It's a large surface area city, right? It's not a densely packed city. But what we're doing with Helix, and this is really Bill McKeon's incredible vision, president of TMC, really doing that. We're partnering with Bill to really enable a lot of what we're doing from the Launchpad. The Launchpad launches from Rice into the Helix. And that is going to be this big magnet, this great attractor, right, of talent. That's one of the things that we really want to capitalize on. And we're not only seeing venture capital and all these sorts of folks who want to make investments, but we're seeing talented people wanting to flock here now. And that's going to be one of the big sort of turning points that we're going to see from this Launchpad and what we're doing in the Helix in particular. That concentration is really, really important. And I think that is a real unfair competitive advantage. And we're happy to be as unfair competitively as we can for now at this stage.
I like that. And I know you two already hit on some of this, but I need to ask, what key factors and methodologies are you looking to employ to ensure both a rapid and efficient progression of the technologies that you're looking to build? And then I guess what everyone would also want to know is, how do you measure all of that?
Yeah, that's a really good question. So, the way we've been thinking about it is our mission, the way we're judging ourselves on, is how many INDs and IDEs do we achieve through the existence of the Launchpad. So, we're really looking at clinical translation. I think, again, with a lot of these quite novel platforms, they sound interesting. Sometimes investors shy away from them just because there's a lot of risk. We want to try to minimize that risk as much as possible by advancing this through large animals, hopefully in some cases through human trials, before we even go out and raise these venture capital funding. And that's one of the missions of the Launchpad. Um, so we obviously can do a lot of things, but we're also going to be choosy and really selective with the projects that we take on. So our criteria is, again, looking at the unmet need, the potential impact that it could have. The core components of the technology need to be at a particular technology readiness level, such that we would be able to go from, concept, meaning project enters into the launch pad, to first in human trial demonstration in no more than 5 years. And if the timelines look like it's going to take longer than that, it's just too early for us to really prioritize our resources and effort. Again, because we're really evaluating ourselves based on INDs and IDEs. And so that's going to be a big priority and a big sort of prioritization factor for us.
And Paul, maybe we can kick this one over to you to kick off. But you know, the Launchpad, you've built this external advisory board, so you've surrounded yourself with these experienced industry leaders. How do the insights from these executives help with accelerate your progress?
Yeah, well, it's really, I mean, this is again Omid's, all credit to Omid on this. Really pulling that external advisory board together has been, is really a lot of Omid's, I think, gravitas. Being able to pull those brilliant people onto here. And Bob Langer's only one of many, a huge one of many, but it was just amazing to have somebody of that caliber on this external board. And then that is really guiding us. There are so many steps, and Omi could give you lots of stories around it. But we there was an obvious thing that he had just recently suggested that was like a no brainer if we had thought of it. But he, in his experience, had advised Omi and said, "No, don't do that. You got to think about this." And that's the kind of thing that gets you more honed quickly and gets you more successful, right? And that's, I think, a lot of it. Omi, do you want to speak to this?
Yeah, so the external advisory board is super critical to what we do. What we wanted to really think about was the clinicians can help us identify the gaps. We have the talent to build product concepts, but that critical question of can you build a business around this idea? Because you eventually need the capital to really push these concepts forward. That really comes from assembling, a group of not only brilliant scientists like Bob Langer, but also we have some of the top VC funds represented. These are really people that have great expertise. They assess technologies, hundreds of ideas on any given day. Like people like Josh Richardson from Goldman Sachs. But also we have people from Fraser Capital, Gates Foundation. And I think a big part of that was these people can help us assess what the market opportunity is. Is this really an investable asset? But more importantly, what does that killer data package need to look like for investors like this to actually back that? And trying to get that insight at the earliest stages of an idea. I mean, there's certain concepts that might be brilliant, but really hard to show in a phase one clinical trial that this has an opportunity. So thinking through those critical indication, those key decisions that companies make, many times, companies don't fail because the technology is bad. They fail because, they pick the wrong indication to showcase the technology. And I think that comes from a sophisticated understanding of, again, clinicians talking to business people, talking to scientists, and all being aligned in what is practical, but also what's impactful. The other piece to this that we're really mindful of, and this is a big goal of what we do with the Launchpad and Rice in general, which is we want to innovate by creating better accessibility. We, of course, spend a lot of effort here at Rice University to make education much more accessible. But the healthcares that we create, we also want to make that accessible. That's why we were deliberate in talking to people like the Gates Foundation, the Bill and Melinda Gates Foundation. We also have Lisa Wright, who is the CEO of Community Choice. It's a healthcare insurance company. It's a nonprofit. She has experience. She used to be at United Healthcare. And I think getting that feedback in terms of pricing, really, how is this going to impact the healthcare system? What we don't want to do is create super overpriced technologies that really cause more healthcare problems than really addressing the challenges that we face today. So all of that really goes into the calculus, which is right up front. We may drop a project, and it is really focusing on the best of the best. Our process involves looking at many, many more opportunities than we actually decide to move forward with. So there is a triage that happens quite early. But even after projects enroll into Launchpad, not everything spins out. Either because maybe the minimum viable product doesn't make sense or the business case could not be made. And I think that's a critical part of this too, is letting the process work its way out. It's actually healthy for some of these ideas to fail. We want to take big swings, and not everything is going to work. But the things that really come out are going to be super vetted. They're going to have, I think, a better probability of success than an average startup would.
And I'm glad you mentioned the projects a little bit. Last question for both of you. Can you talk to me about some of the projects that the Launchpad is supporting right now?
Yeah, so we have about 9 companies that are being evaluated and pressure tested right now. 9 ventures. Each one has an RL designation, so we're up to RL, uh, uh, RBL, Rice Biotech Launchpad. So we're up to RBL 9 right now. One of them we just had a press release on last week. We had and it was really catalyzed because of this publication that came out. It's a really innovative device that can be wireless controlled. And what this device does, it allows you to have an implantable bioreactor. It creates oxygen on site through electric catalysis. It's intended to support cells, but we're really thinking through the indications that are needed. Is it cell therapies? Is it ischemic tissue repair? Is it organ transplantation? So a lot of these are being evaluated right now. That's kind of the work of that particular company, talking to investors, talking to all the different stakeholders. But that's a really cool project we're really excited about because it has the potential to really disrupt um, living drug factories, as we call them. Biologics, biology requires oxygen, and this is a way to create these living drug factories that could last for years, rechargeable. And I think that's quite innovative, and that's one of the things that we're pushing forward right now. But there's, like I said, there's 8 other things. So we're gonna have an event later on this year where we announce the first set of um, projects, ventures, um, and so be happy to come back and talk to you more about them at that point.
Yeah, no, I'm excited to hear more about those and continuing to see how this initiative, how this Launchpad continues to grow. I think having you two so involved with it is a huge win for the Launchpad and for the projects, these companies that are going through there. Really look forward to staying in touch with both of you, and we'll have to have you come back on in the near future.